This short video, created by the NHS Kernow Care Home Support Dietitians, provides nutritional information on managing residents who have or are recovering from COVID-19.
What particular considerations are needed in care homes when managing COVID-19? How might the symptoms of COVID-19 affect your residents' nutritional status? What is the best course of action for managing these side effects and optimising nutritional intake? Why is protein important at every stage? And how can you use the food-first approach to prevent malnutrition? We'll answer all these questions in this video.
Residents who are elderly and already at risk of malnutrition are likely to have worse outcomes from COVID-19. Screening with the Malnutrition Universal Screening Tool, or MUST, is therefore essential.
A third of care home residents may already be at risk of malnutrition. Screening monthly will help to identify them and guide your care planning.
Electronic care record systems often have a function to calculate MUST automatically, provided weights are recorded. And the online MUST calculator may be useful for those still using paper.
If infection control procedures do not allow for weighing and screening residents, you can use the subjective criteria section of the MUST to inform your overall impression of malnutrition risk. The BAPEN website contains links to the MUST tool, the MUST online calculator and the MUST explanatory booklet. If your home would like some additional training on MUST screening, please contact us on the details at the end of this video.
COVID-19 is a new infectious disease with symptoms that differ from person to person and that may continue into the recovery phase. These can include fever, coughing and difficulty breathing, changes to taste and smell, and general weakness and pain. Less common symptoms include nausea, vomiting and diarrhoea.
For those with severe and long infection and who may have been hospitalised, loss of muscle mass may occur. Swallowing difficulties may also occur where patients have been intubated, sometimes requiring texture-modified diets both during admission and following discharge.
Many will experience reduced appetite, poor intake and in some cases poor absorption. Nutritional needs may therefore be difficult to meet and ongoing longer-term support is likely to be needed.
A reduced sense of taste and smell or a metallic or salty taste may occur during and after COVID-19, impacting on the desire to eat. Offer a range of different flavours, textures and temperatures to find out what is preferred. Re-offer foods that are turned down. Tastes may continue to change.
Try using stronger, sharp or tart flavours like citrus or mint. Experiment with herbs, spices, pepper, chutneys and pickles in cooking. Add condiments such as horseradish, mustard, pickles, applesauce for extra flavour. Using plastic or wooden cutlery may help reduce metallic tastes within the mouth.
For those with breathing difficulties, who are very tired or have a small appetite, offering smaller, more frequent portions of energy and protein-rich foods, the ones they enjoy most, is likely to lead to increased intake. Using a smaller plate for this may be less overwhelming.
Choose softer and moist foods that take less effort to chew and swallow and encourage taking smaller mouthfuls.
Give your residents plenty of time to eat. They may eat slower than they usually do. Using special bowls or plates that keep the food warm for longer will help with this.
Give nourishing drinks to sip on in between meals. Try fruit juice, milk, hot chocolate and malted drinks.
Where appetite is very minimal, discourage drinking with the meal as this may cause fullness. Fresh air and gentle exercise can be used to help stimulate appetite if appropriate.
Residents may require extra assistance if they are particularly tired and may become more tired as the meal goes on.
Severity of infection can range. Those with mild or no symptoms are unlikely to experience nutritional side effects. If they are to be considered at low risk of malnutrition, a healthy balanced diet should be provided. Those with severe infection, resulting in reduced intake and loss of muscle mass, will take longer to recover. Appetite may take longer to return to normal as well.
Whatever someone's starting weight, Weight loss during infection may be largely muscle mass and lead to weakness. This can result in poor immunity and increased risk of pressure ulcers, both of which are consequences of malnutrition. Treating weight loss and malnutrition in obese and overweight residents is equally important as it is for underweight residents. It may, however, be more appropriate to aim for weight maintenance and rebuilding of muscle mass rather than for weight gain, especially if weight is still being lost.
For maintaining strength, promoting healing and building muscle mass, sufficient protein should be given both during the illness and whilst recovering, especially for those who have lost weight.
Eating too little protein, particularly for long periods, will contribute to muscle weakness, frailty and slow recovery.
Protein requirements in the elderly tend to be higher, although intakes lower, so support with this is vital.
Offer protein at every meal and in some snacks too. Good sources include meat, fish, eggs, dairy, soy, tofu, beans, pulses, nuts and seeds.
Easier to chew options include minced or stewed meat, fish and meals served with a sauce or gravy. Nut butters and ground nuts can be a good alternative to whole nuts.
Milky drinks in between meals will also help ensure sufficient protein over the day.
Where aiming for weight gain, make sure full-fat dairy products are given.
The malnutrition pathway link on screen provides additional information on protein sources.
Food First is the first-line treatment for malnutrition risk. The 1-2-3 approach summarises how this can be achieved and will help to ensure sufficient calories and protein are being provided both during and after COVID-19 infection.
This simple and effective approach recommends that 1 pint of fortified milk, 2 nourishing snacks and 3 two-course fortified meals are offered daily to residents at risk of malnutrition in a little and often approach. Adding nourishing or homemade fortified drinks can also provide vital additional nutrition and are often well received.
You can access full information sheets and recipes for the 1-2-3 approach and homemade fortified drinks on the NHS Kernow CCG website under the tab entitled Your Health and in the Nutrition section.
Fortified milk is made by mixing 1 pint of ordinary full-fat milk with 4 tablespoons of skim milk powder. This does not increase the volume of the milk, but makes it more concentrated in both energy and protein.
Use fortified milk throughout the day in place of normal milk. It can be surprisingly easy to use 1 pint when used in cereals, porridge and egg dishes for breakfast, in soups, sauces and mashed potato for main meals, and to make milk puddings such as rice pudding, semolina and custard for desserts.
It can be especially useful to include in a nourishing drink such as milky coffee and tea, hot chocolate, milkshakes, or it can be served cold as it is.
Snacks can provide vital additional nutrition to those not eating well and at risk of malnutrition. Find out what snacks are preferred and offer at least 2 snacks per day away from meal times.
Offering a range will be more tempting. This could be biscuits, cakes, cheese and crackers, chocolate, toast, a small sausage roll, and there are many more you can try. Snacks higher in protein should be prioritised at this time.
Our top recommended snack is a fortified thick and creamy yoghurt, high in both calories and protein. This quick and easy recipe could be made by any care or kitchen staff. Simply mix a heaped tablespoon of skimmed milk powder and a tablespoon of double cream into a thick and creamy yoghurt.
Offering 3 two-course fortified meals will also ensure extra calories and protein are given to those with a reduced intake. Fortification means adding ordinary food items such as butter, cheese, cream and milk powder. There are also many other foods you can fortify with, some of which are high in mainly calories and some are high in both calories and protein.
Higher protein options should be used regularly and include skimmed milk powder, cheese, thick and creamy yogurts, nut butter and ground nuts. Higher calorie options include cream, butter, oil, mayonnaise, sugar, jam, syrup and condensed milk.
Ensure preferences are addressed. Some residents may prefer meals that are less rich and creamy. For those residents, it is important to persevere and identify where fortification could be added and is tolerated.
Fortified meals should be balanced and provide a range of all the nutrients needed, so adequate protein, starchy carbohydrates and vegetables. You might also include fruit in a pudding.
If you feel that your resident has not got a balanced, varied diet, an over-the-counter vitamin and mineral supplement should be considered. It is also advised that people living in care homes take a daily vitamin D supplement.
Nourishing drinks, especially those milk-based, are a useful way of providing even more calories and protein. Recipes for homemade fortified drinks can also be found on the NHS Kernow CCG website. These are particularly useful where appetite and intake are poor.
They are specially formulated to provide a large amount of energy and protein in a smaller volume, alongside additional vitamins and minerals. They are not intended as a meal replacement, but as a drink in between meals and can be given as they are or in small volumes such as 50ml shots over the course of the day.
The fortified milkshake and hot chocolate recipes use full-fat milk, double cream and skimmed milk powder, together with a fortified powder with additional vitamins and minerals. They provide equivalent energy and protein to many standard prescribed oral nutritional supplements. We also have a recipe for fortified fruit juice, and although not as high in energy or protein, can be useful for those who do not like or who cannot tolerate milky drinks.
Good hydration remains important whether your resident is healthy or sick. It is recommended to aim for 6 to 8 mugs or large glasses of fluid a day, which is about 1,600 to 2,000 ml. All fluids except alcohol count towards fluid intake, including tea and coffee.
If a resident has a fever, the weather is warm, or they have been physically active, fluid requirements may be higher. For those struggling to take drinks sufficiently, foods high in fluids such as soups, sauces and custard, yoghurt, jelly, ice cream and ice lollies, milk in cereal, fruits and vegetables will all increase fluid intake. Hopefully this video has answered your questions around the nutritional side effects of COVID-19. You'll find that many of your residents will do well with the 1-2-3 approach and using nourishing and homemade fortified drinks.
If you find this food-first approach is not sufficient to improve the nutritional status of a particular resident, contact their GP who may make an onward referral.
As the care home support dietitians, we're offering more in-depth training and resources around identifying and managing malnutrition with the food-first approach. If you're a care home in Cornwall and would like to access this free training or have any other queries or questions, please do contact us on the email on screen.
We hope you have enjoyed this video and found our resources useful. Thanks for watching.